Morning, everyone. We are Team Slytherin from Lendi Institute of Engineering and Technology. Our team is a mix of developers, designers, and problem solvers who strongly believe in using technology with empathy at its core. When we saw this problem statement on prototype design for a digital health record management system for migrant workers in Kerala, we didn't just see a challenge. We saw people who build our homes, work in our factories, and power of our economy, yet struggle to access something as basic as healthcare. So imagine this: a migrant worker in Kerala, far from home, working long hours, falling ill. He visits a clinic, but his medical history is missing. The doctor doesn't know his allergies, his past treatments, or his chronic conditions. Tomorrow he moves to another city, and the cycle repeats. For millions of migrant workers, healthcare is fragmented, inconsistent, and often safe. And our problem statement states that in India, migrant workers form the backbone of our economy, yet they remain invisible when it comes to healthcare. No consistent health records across states or hospitals, language barriers that make medical communication difficult, frequent relocation, leaving workers without continuity of care, low digital literacy, which excludes them from complex health apps, and finally, the result: delayed treatments, preventable illness, and lost productivity. And here is the bigger picture. Our Prime Minister Sri Narendra Modi ji had said that in multiple events that India has been marching to be the supreme nation by 2047, and he also endorsed that migrant workers is gonna be the backbone in this entire process. And the very backbone, the migrant worker is suffering with these kind of health issues. Are we gonna make it by 2047? So we asked, what if every migrant worker carried their health in their pocket, safe, portable, and accessible anywhere in India? So the answer is our platform, which is MigrantCare, one of its kind, a web and mobile first platform designed with empathy, accessibility, and security at its core. One system that ensures easy access, portability, and privacy of health across languages, states, and healthcare. So the key features are: for workers, it's a mobile first simple navigation with multilingual support, and it's a QR based portable health card, works offline and can be scanned everywhere. Secured and privacy login, emergency info screens, allergies, blood types, and chronic conditions. And we'll also be including AI and automation like AI chatbot with multilingual guidance, AI chatbot with multilingual guidance and predictive analysis for early risk detection, digital health literacy assistant to expand prescription in simple words. So let us see the working of a prototype. So the UI looks pretty simple like this: the digital health records for Kerala migrant workers, secure, portable, and multilingual health record management system designed specifically for migrant workers. Access your health data anywhere, anytime in your preferred languages. And see, these are some of our key features: secure and private. Your health data is encrypted, protected with advanced security measures. And we are also been providing QR health card, which is the very, very, very much innovation in our project. And it's multilingual support because uh, migrants can be anyone. Like they're from Bengali, they're like from Telugu, they're like from English, they're like from Tamil, Bengali, English, Malayalam, anywhere from like that. So we are providing all the multilingual support over here. And with this, you could also start managing your health records, empowering health access. So these are our key features. And let's dive into the working of our prototype. So you could see everything like this over here. So on the very first dashboard, you will see the total records, emergency info, and language that I had preferred. So this remains plain till now because I am the new user. Till now, I didn't use this app. So these are the recent health records and no health records yet. Visit a healthcare provider to get started. So these are the things. So if you go to this another section which is health records, it shows my complete history of our medical records, and then the QR health card. So you could scan this. So it generated an unique QR code for me, and by scanning this, I could access all the details of my health, and I could also connect to the healthcare providers like doctors, nurse specialists, and neurosurgeons, and everyone like that. So by scanning this, I could access this entire health information, and this is my AI chatbot, which would assist me. Like if I would say, "Hey, hi," you could see that AI assistant is responding, "Hello, how can I assist your day? If you have any health related questions or need guidance, feel free to ask." I would say I'm feeling unwell. Okay. I'm sorry to hear that you're not feeling well. Can you please tell me more about your symptoms? For example, are you experiencing fever? Let's say I'm feeling, I'm experiencing fever. I'm sorry to hear that you're fever. So it's also giving me the kind of things that I have to follow. Measure your temperature, use a thermometer like this, and stay hydrated. Make sure to get enough rest. Over the counter, monitor symptoms, seek medical help, everything like that. So I have everything over here. So the innovation of, if you ask the innovation of this project, like Apple, like iPod grab all the 1,000 songs into your pocket. We are grabbing everything into regarding your health into your pocket. So we are putting everything which you need, which every migrant worker have to need, because migrant workers works relentlessly. So they need something like that. So they need some specific care about like that. So this is not just a medical record system. It's the first end-to-end digital ecosystem for migrant work health, portable and offline, designed for workers with low literacy, multiple languages, and high mobility. And it's totally secure, scalable, and green, because we are using cloud native optimized resources for sustainability. And if I have to put it simple, it's like an Aadhaar for health, but smarter, safer, and built for the people who need it the most. So this is about our project. When it comes to the tech stack, we used MongoDB for the database, React for front end, and Node.js for the back end. And we also use some kind of APIs and like that. Like we used AWS clouds for deployment and storing the data, huge amount of data clusters. And when it comes to the impact for workers, it gives you the better health access, dignity, and reduced medical risks. For doctors, it gives faster, accurate care with access to past medical history. For society, it fuels the health emergencies, lower costs, improved work productivity, and for government, rich anonymized health data for policy making and targeted interventions. So they could get the entire data of migrant workers, like how the whereabout of migrant workers, so that it makes their work even more easier. So as I already said, the tech stack, it's React for the front end, back end Node.js and Express. Database, we used MongoDB, and we used NLP, which is sentimental analysis for our chatbot. And when it comes to security, we are using OAuth2 or JWT tokens. And then cloud, we used already I had said AWS. And integration, we had used for telemedicine, pharmacy, insurance, and IoT wearables. So when it comes to our closing vision, our mission is simple. Healthcare should not depend on where you are, what you earn on, or which language you speak. With this system, a migrant worker in Kerala will carry not just a health card, but dignity, safety, and continuity of care. Because when we heal the invisible backbone of our economy, we heal the nation. So we are the team Slytherin, and with this digital health record system, we give every worker the power to carry their health anywhere, anytime. Health in their hands, dignity in their journey. So this is our idea: empowering migrant workers, empowering our nation. Thank you.